Hi, I'm Rachel Aiello,
And I'm Nick Nanos.
and welcome to Trendline. Nick, how's week? Oh gosh, I've lost count of lockdown going for you.
How about this? I went to high school in Oshawa. We'd say, I'm hanging in there. I'm hanging in there. How's that?
Good to hear it. I'll take it. I think that's the best any of us can hope for right now. So we have a lot to get into today. So let's start with what we promised our audience last week, new pandemic report cards. So you've been gathering from Canadians kind of how they're grading their provincial governments on the handling of the pandemic. We're now well into wave 3. Is it Fs across the board?
You mean as in the letter F? No, not quite. They have veered into F, but it's definitely a D for both the federal government and for provincial governments. Actually, I have to put an asterisk beside that. It's definitely an F provincially for the government of Ontario. So think of it this way: when we ask about provinces, the national number for province satisfaction, or the report card on the vaccine rollout, is 5.6 out of 10, which is a D. But in Ontario, they're into new territory, 3.9. So that's like not just underwater, Rachel. That's kind of like, I don't know if we can do this, diving down further on the score out of 10. But at the top of the list, because we have to give a tip of the hat, if you happen to be in the province of Quebec, you give your province a score of 7.6, and in Atlanta 7.2. But Ontario definitely an outlier. Lots of grumpy people in Ontario when it comes to the Ontario government on the vaccination.
Yeah, grumpy people who haven't had their hair cut, and unfortunately are watching a lot of people around them in really hard spots. So that point there you mentioned, Nick, I really wonder if part of it, of course, it has to do with the fact that we're in a third wave, and governments promised to learn by now. But I think it's also we're starting to have the accountability conversation, even though a lot of people thought the pandemic would need to end before we dig into what went wrong. There's been 2 reports in the last little while coming out about how the Ontario government handled long-term care. And it's just been, really questioning this iron ring that they promised around these homes. Here's a clip from the minister responsible facing questions from journalists about whether she takes responsibility for it.
Minister, can you stay a little longer? There are more reporters on the phone line, and this is a very important issue. Do you have any more time?
And we have questions from the floor, Minister. We have 2 questions from the floor, and we have people on the line that would like to ask more questions. I'm wondering why you're running out.
And she's gone.
So Nick, she's, the question she did take was saying that I'm only one person, and there's, a long history of long-term care being a problem, but also then just walking away. Do you think now that because people have had a full year of thinking and hoping things would get better, that the blame is starting to move from the feds to the provinces?
Well, I think right now a lot of Canadians are asking, what could have been done, what should have been done over the last year. And I know hindsight's 2020, but everyone has to take responsibility. The federal government has to take responsibility for the procurement of vaccinations, and provincial governments and municipalities have to take responsibility for what's happening on the ground. And I think the last thing that any individual wants to hear is for a politician to say, I'm only one person and it's not my fault. Because the fact of the matter is that the Ford government has been in power for more than just a year, for a number of years. And the thing is that there are issues related to long-term care facilities before this, but the pandemic has put a spotlight and has exacerbated some of these issues within some long-term care facilities in Ontario.
Yeah. And I think part of it too is a lot of people are burning out. People could hold on when they were told a few more months, last March. But now it seems sometimes that this is never going to end. New variants are arriving, and, questions are being raised about when we're actually going to be back to normal. You've been kind of surveying Canadians on how they're handling this, 16 months into self-isolation. From a mental health perspective, where are Canadians at right now?
Well, we asked Canadians just in the last week or so how they would describe their mental health, whether it was better or worse compared to before the pandemic. And about 44% of Canadians say that their mental health is worse or somewhat worse compared to before the pandemic. But the interesting thing, Rachel, is that last year at the beginning of the pandemic, last April when we asked this, it was 38% in terms of people self-describing it as being worse. So think of it this way. If we are walking down the streets in our neighborhood and we see our neighbors, a minimum of 4 out of every 10 of our neighbors are self-reporting that their mental health is worse or somewhat worse off than it was before the pandemic. So maybe we have another pandemic going on, one related to people's mental health. And what the trending suggests is that it's not better than it was in the first wave. It's actually a little bit worse than the first wave. And a lot of this has to do with what you're talking about. There's still uncertainty about the end. Many people are doing what they're asked to do to fight the pandemic, but it seems like we just can't win on this one.
Yeah, and it's a great point to think about when you're at the grocery store or passing someone on the street. Everyone's in a different situation right now, and totally right that this is going to be something that we're all facing and having to hold governments to account on, making sure that the supports are there going forward on this. Okay, so that said, we are going to link to some resources in our show notes for anyone. If you are one of those people who is having a hard time right now, that's completely understandable. You are not alone. So we're going to get to a break in 1 minute, but first, we want to hear from you, the listeners, the viewers of Trendline. If you have questions for Nick or I about federal politics or polling, anything really that we've talked about on the show, we want to hear from you. So we are hoping you can send us an email. You can reach us at .com@bellmedia.ca. That is DOTCOM@bellmedia.ca. Just put Trendline in the subject matter. We'll take a look at what you've asked, and in a future episode, we'll dig into those. That said, Nick, stick around. We'll be right back. Welcome back, Nick. Let's get into what, I don't know about you, but definitely has consumed most of my attention over the last, number of days. Definitely has gotten a lot of airtime. This conflicting advice when it comes to vaccines. So we've heard from the National Advisory Committee on Immunization in the last few days saying, there might actually be preferred vaccines, the mRNA, so the Pfizer or the Moderna, as opposed to the viral vector AstraZeneca or Johnson & Johnson shots. I will note, as someone who's covered this for a while, it wasn't the first time they've said this. It was just the first time a lot of ears got put on it, I think. And it is, of course, in contrast with the advice we've heard from Health Canada, other federal officials, provincial, anyone who's a public health voice lately saying, get the first shot that's offered to you. They're all good. They'll all protect you. I'm just wondering, this again, how many times have we talked about mixed messaging in this pandemic? What do you make of this NACI confusion?
Well, it's not good from a public health or from a public communications or a public confidence perspective. That's all Canadians want to know, quite simply, is what do you want me to do, right? And, one of the key messages that kind of came out for the diversity of vaccinations that are out there was basically get vaccinated, because if you get vaccinated, setting aside the efficacy, that it's 100% effective at keeping you out of the hospital and making sure that the virus doesn't kill you. And people can understand that. And I think that when we start to see different healthcare stakeholders and experts start to add extra things and extra complexities, it basically undermines credibility because it creates confusion and people don't know what to do. And, the other thing is that, what's important is not to have disagreements among public health practitioners, because there's already a lot of confusion out there for some Canadians just because of some of the things that are not true that happen to be on the internet. And I think this was a bit of a step back for public health and public health experts writ large. And hopefully they'll be able to kind of move back on what I'll say, a monomaniacal single track message to tell people, get vaccinated. It's the best way to create herd immunity. It's the best way for you to stay out of hospital. It's the best way for you to protect your loved ones and your neighbors.
Yeah, and the best way for us to get out of this as quickly as possible as well. I understand, vaccines and the efficacy, it's a nuanced thing. Yes, there are risks with certain ones, very, very rare ones, and people absolutely have the right to be told about those and factor those into those decisions. But I think the way that they phrased it in suggesting to wait, when realistically, the number of mRNA vaccines coming into this country, I don't think a lot of people will be waiting for those. We don't know when the next shipments of AZ and J&J are coming. So I think it's something we're going to have to keep watching. Of course, NACI's been highly influential in the past. They're the reason most provinces are doing a 4-month interval between doses, but it doesn't seem like some of their latest advice is getting taken. So a shift we'll have to watch as their vaccine rollout kind of continues. But the question a lot of people have asked is whether this is contributing to hesitancy. Canadians have the ability to, read up on this, and there's a lot of information, and presenting all of it, I would think, is a good thing. And rather than trying to, cover up the fact that yes, blood clots are possible. I'm just wondering, with, more and more people now able to get vaccinated, Nick, where do you think people are when it comes to wanting to take that turn when it is theirs?
Well, we've been very fortunate in Canada that it doesn't matter which survey that you look at, the vast majority of Canadians want to get a vaccination as soon as possible. And they don't really have strong feelings about whatever that vaccination is, because they just want to get their first jab. And I think that's the good news. I don't think something like this will have a material impact on people wanting to get vaccinated, but what it will do is just start to create questions. And we don't want people to think, and I'm not sure how helpful it is from a public health perspective, to think that getting your vaccination is like going to the buffet, where you get to pick one vaccination over another because you feel that something might be better for you. The fact of the matter is that we have a public health system. It's there to serve everyone. It procures vaccinations as fast as possible for everyone, and the right vaccinations are kind of made available through different channels. So I don't think this is going to have a material impact on the proportion of Canadians that will get vaccinated, but they'll just be asking more questions about stuff. And there's nothing wrong with asking questions. Rachel, I'm in the question asking business. Nothing wrong with asking questions. So it's just might create a little bit of a hiccup, but I don't think it'll be a major setback.
Okay, that is good to hear as someone who's also in the question business. And Nick, you just kind of threw me there. You mentioned buffets, and I had to think, what is that? Are we ever going to be at one of those again? Tangentially related, stick with me while I do this attempted segue. We saw, somewhat related this week, the Prime Minister get into the conversation around lockdowns and anti-lockdown protests. They continuing to happening across Canada. We saw a pretty major example, a rodeo in Alberta recently. It seems like Prime Minister Justin Trudeau has had enough. Here's what he had to say this week.
These protests are supposed to be about getting back to normal, but by spreading the virus, they do just the opposite and prolong lockdowns. So follow public health advice, but don't do it for me or for any politician. Do it for someone in your life that you care about. Do it because you respect your fellow Canadians.
So Nick, who do you think that message was actually for?
Well, I think that message would be for the minority of Canadians who are kind of vaccine hesitant. But the one thing that we have to remember is that everyone wants to put this pandemic behind them. Everyone wants to get back to some sort of normalcy. It's just that we have to have the realization that the only way that we can get back to that is if as many individuals as possible get vaccinated, and that we continue to follow the rules. I don't think, Rachel, that we're going to see, a big boom in vaccination and everything get back to normal. I think realistically, we'll have to continue to be very careful, wash our hands, wear face coverings, and be careful. To your point about the buffet, I don't know. I don't think it's good to be in the buffet business right now for the foreseeable future. So I think that's targeted at everyone, including people that are following the rules, and the minority of people that are just, it grates them the wrong way when they're told by the government to do this or to do that.
Yeah, and I think kind of flipping the idea of you want the restrictions to end, you don't think things should be closed, you want businesses to reopen, but the longer that COVID is spreading, the longer it's going to take for that to happen. So I think in another conversation, he also called it a bit ironic, which I think is worth noting. Keeping on the vein though, Nick, of the new normal and getting back to some semblance of normalcy after this and reopening things. The conversation around vaccine passport seems to be heating up even more. The government basically all but confirmed this week that we are going to have some kind of paperwork that you have to show if you wanted to travel abroad, at least. I don't think it's going to be something we'll see domestically, but looking at apps or some sort of paper or card that you'll have with you to prove that you can go abroad and travel because you've been vaccinated, or if you are from another country and want to come visit Canada, you also have to be vaccinated. I'm wondering, Nick, where things stand on vaccine passports. What have you heard from people about the level of support for this as something going forward?
There's a new survey that we've just released that we completed for CTV News, and we asked Canadians how they felt about kind of having documentation, vaccination documentation, in order travel within Canada, in order to go to large sporting events or large gatherings. And about 3 out of every 4 Canadians are supportive of having what I'll say a vaccination documentation. The other interesting thing, Rachel, that I've seen in polling around the world is that as soon as you start to use the word passport, some people get their back up. That it's actually better just to say what it is, which is you will need to provide a proof of vaccination in order to do certain things, in order to travel from one region to another, in order to maybe go to your favorite sporting event, even if it's social distancing. And the good news is that a very strong majority of Canadians support having documentation in order to do those things. And I think they just see it as a way, not just to protect themselves, but for other people to be protected, and for us to be responsible and not spreading the virus beyond our borders or to different parts of the country.
And in the meantime, where are people at with the current border measures? You know, we're hearing from certain premiers that still more needs to be done to ensure that travelers from abroad aren't bringing variants into Canada. With the current level of, you know, quarantine hotels, flights restricted from certain countries, what's kind of the public consensus right now on the state of our border lockdowns?
It's interesting, you know, Canada is a border country. 90% of Canadians live within a 1-hour drive of the Canada-US border. And to put this into context, if you remember back in 9/11, when the Americans closed the border, Canadians, from a polling perspective, overwhelmingly wanted to keep the border open between Canada and the United States in order for people to go back and forth. Fast forward now, and you know, we're not fighting terror, we're fighting the pandemic and the COVID-19 virus, but 71% of Canadians in a survey that we've just completed want to keep the Canada-US border closed to non-essential traffic for the foreseeable future. So it's not even like for a couple of weeks, not even for a month, it's like for the foreseeable future. And only 8%, or less than 1 out of every 10, want to see the border open to non-essential travel. So, you know, for Canadians, even though they see that the Americans have been making serious and significant headway on vaccinations, because they've vaccinated, what is it, Rachel? 200 million vaccinations have gone out the door in the US?
At least, yeah.
Yeah. Even with that, Canadians still want to keep the border closed for the foreseeable future. So it looks like we want to be a little prudent on travel and individuals crossing the border into Canada.
That is interesting, especially considering here, Alberta, at least anyways, is now definitely one of the biggest hotspots across North America. And more, it's going to be the situation where cases are dropping there and more people are fully vaccinated and could have the opportunity to come to Canada safely. So we'll watch this and obviously stick on this. The border is definitely at least closed until May 21st, I think, but surely it'll get rolled on again. Okay, Nick, this was a full episode, but you have some great news for our bright spot that we can tell our readers or listeners about.
I know as a rule, we're not supposed to talk about our personal lives, but I have received the jab through the Ottawa Public Health. So thank you, Ottawa Public Health. And I'd like to say that I went online, I got my appointment, I booked my second appointment, I showed up at 11:20. Well, I showed up 10 minutes before because you're supposed to show up 10 minutes before. And my appointment was for 11:20. And you know how much of a precision freak that I am. At exactly 11:20, I was being injected with the vaccine, and everything's been good. You know, a little sore in the arm, but no side effects or anything. So it was a great experience logistically, and I'm glad now at least I have a schedule on when I'm going to get my second vaccine. So all's well.
That is excellent news. Love to hear it. That is so great. Thank you, Nick, as always. If listeners or viewers want to read more about your latest, where can they find you?
If you're a data hound, visit the Nanos website at www.nanos.co to get all the stats, or follow me on Twitter at Nick, N-I-K, Nanos.
And you can follow me on Twitter at Aiello. You can listen to Trendline on CTVNews.ca, the CTV News YouTube page, and everywhere you get your podcasts. Thanks for listening.